Lots to talk about tonight with Congresswoman Debbie Wasserman Schultz, Democrat of Florida. Congresswoman, Minority Leader Boehner's office has put out a statement tonight in which he calls reconciliation, quote, a procedural trick that Democrats are trying to jam through the Congress. But we have yet to hear directly from the president on reconciliation. What are you hoping to hear from the president on Wednesday on the way forward?
Well, that's interesting that Leader Boehner would say that. That must make him a magician, because he was fully immersed and involved in all of the reconciliation efforts of the Republican leadership over the last number of years, including the Bush tax cuts, which are even larger than in terms of cost than this health care reform proposal. The bottom line here is that we just need to pass health care reform with a simple majority up or down vote. As you said, Lawrence, the Senate has already passed a health care reform bill, comprehensive health care reform, with 60 votes, a supermajority. Reconciliation, which is, Washington speak for a simple majority, would just clear up the differences between the House and Senate bills and make sure that we send this bill to the president's desk and not allow the Republicans to continue to be obstructionists, which is what they're interested the most in doing.
Do you think that wavering Democrats in the House need to hear the word reconciliation from the president? Do they need specific leadership from the president validating going forward in a reconciliation bill?
I think the president needs to remain fully immersed in this. I think he needs to continue to quarterback the bringing the ball across the goal line here, so to speak. That's going to be a critical component to making sure that we can get this done.
What is happening in the House as you watch the public option gain favor in the Senate as part of a possible reconciliation bill? Is that giving more possible momentum for the House to insist on a public option being in the bill?
Well, of course, we passed a health care reform bill out of the House with a public option in it. The majority of our caucus continues to support that. But I think very likely we will pass health care reform without we are more likely to pass health care reform without a public option because we've got the Senate bill as the template, and the reconciliation provisions need to be directly related to budget measures. So I'm not sure that we can do a public option under the simple majority rules of reconciliation.
Now, the leadership has been pretty frank. In fact, they've been more open about this than I've ever seen them, admitting that they don't feel that they have the votes as of now in the House. What do they need to get those votes? Do they need time? Are there persuasive devices that they have yet to use that they can use?
Well, I think once we start counting, we will reach the now 216 votes that we need to send this bill to the president. With the resignation of Congressman Deal, the Republican from Georgia today, we now have we need a majority which includes 216 of the members of the body currently. So I think we're going to be working hard to figure out what members' remaining concerns are. We also, as the Speaker has stressed, need to put together the final legislative package and shop that to members, make sure they understand what's in it, find out what their concerns are, and as we begin to whip this legislation, I'm confident, as the Speaker is, that we'll get there.
One thing House members have trouble being confident about is what the Senate is going to do. What do you need to see from the Senate before the House can act?
Well, we do need to make sure that they are going to pass they're going to give us a simple majority vote on the remaining measures that we need to work out on the differences between the House bill and the Senate bill, because obviously it's very important. We have put our votes up on the board for health care reform. We have consistently been there and underscored the need to make sure that we can bring costs down for the American people, provide some security and stability to those who have health insurance, and with the $100 billion deficit and the deficit reduction measure in this bill, we're going to be able to get there.
Congresswoman Debbie Wasserman Schultz of Florida, thanks for your time tonight.